Hello and welcome to Let's Talk HR with Dr. Deneen, the talk show that spotlights HR professionals and talks about all things HR. Healthcare disparities are a major crisis in today's society. Healthy People 2020 defines a health disparity as a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage. While many efforts are being done to address the issue, what can HR do to help make a difference? What can organizations do to make an impact? Well, my special guest is someone who will let us know how to do it. He is Quintin Robinson, founder and principal of Innovative Global Solutions, IGS Advisors. Welcome to the show.
Thank you for having me, Deneen. It's such a pleasure to be here with you today.
It is a pleasure that you're here. Now listen, you are a game changer, and I know this, in the HR arena and the healthcare arena. Please share with us your professional journey.
Sure. So I'm a journalist by training. So I spent the early years of my professional career as a newspaper reporter and editor here at the Commercial Appeal newspaper.
Yeah.
And transitioned into human resources, employee relations manager for the newspaper. So then I ended up getting out of that industry entirely, moved over to Bentonville, Arkansas, and became a senior HR manager at the Walmart home office.
Yes.
So HR leader at Walmart, then human resources director at the city of Memphis, where I think I had the pleasure of being your leader, and if I might say, still one of my favorite employees. And so spent time at City of Memphis as HR director, Shelby County Schools as director of HR operations and strategy, and then transitioned into the healthcare space as vice president of sales and account management with Cigna. So now I'm taking all that I've learned during my 20 plus years on the HR journey and packing that into a consulting business.
So tell us about that. It's you're the founder and principal of IGS. Tell us what that is.
Sure. So IGS Advisors, and as you stated, Innovative Global Solutions. We advise individuals, small and large businesses, on making the best benefits choices, whether it's an individual who is shopping for healthcare in the marketplace, a retiree who is shopping for Medicare Advantage, or a small business that is seeking a commercial plan, or a large business that's seeking a commercial healthcare plan. So that's what we do. We advise on the best solutions, and just got out of the gates early July, so I'm started on a new journey now.
Yes, that's a new journey. It's a little bit off of HR, but it's still HR. And let me just share a fun fact or a wonderful fact. This is one of the greatest leaders in HR I've ever had the pleasure of working with.
You're too kind.
But just wanted to put that in there just to say that. So we know and we hear about healthcare disparities in the news all around us, but we sometimes don't get all the details about it. So what are healthcare disparities?
So I think you summed it up. It's unfavorable health outcomes due to socioeconomic status, education status, environmental status, and overall it's just not having access to quality, affordable health care, and just the poor outcomes that individuals who are in those groups typically experience.
Yes.
I think one of the glaring examples of health disparities that we can look to is COVID-19. When COVID-19, the pandemic hit, disproportionately African Americans, Latinos were impacted more severely, again, because of those disparities, lack of access to testing. Living in multi-generational households where we're not able to socially distance, not having adequate health care coverage. One of the biggest factors was underlying health conditions. There's so much hypertension in our community, diabetes in our community. So when individuals contracted the COVID-19 virus and they already had these pre-existing conditions,
yes,
it meant a more serious health crisis for those individuals. And in many cases, unfortunately, those outcomes were death. And so, so that's what we're talking about when we say health disparities.
Yes, absolutely. And you know the story about my husband and before there were vaccines.
Yes.
We both experienced COVID. He, stayed in the hospital 100 days on the ventilator for 42 days. Yes. All of these things, but we had health care.
You had health care.
We had it.
Yes.
But what happened? There was not a cure for it at the point, or there was not vaccinations for it. So it did play a big part in the community, as well as hitting home professionally.
Yes,
so it was a tough time. So these are all staggering statistics. Are there any other statistics you can share with us in terms of disparities?
Sure, I'll share some statistics, some startling statistics with you. 10.6% of African Americans are uninsured, compared with 5.9% of non-Hispanic whites.
Wow.
13.8% of African Americans report having fair to poor health, compared with 8.3% for non-Hispanic whites.
Wow.
80% of African American women report being overweight or obese, compared to 64.8% for non-Hispanic whites. 12.7% of African American children have asthma, compared with 7.7% of non-Hispanic white.
Wow.
And the list just goes on and on. And again, it ties back into those health disparities, not having access to the information that we need to keep ourselves well, not having access to proper medical care, not having insurance. All of those things play a role in the startling statistics that I just rattled off. And again, the list goes on and on.
And it goes on and on. And I mean, it's just staggering to hear this, and the lack of information, or the access is what you say.
It's access.
The access to information, where to find the information, where you can go to get the information. There's health care for everyone, but where can you go to get that? So that is so. So in most organizations, HR, they lead the efforts and employee benefits that healthcare will fall within. So can HR influence and build employee programs to address disparities?
Absolutely, that's a fantastic question. And when we think about healthcare, we think about our healthcare plan. We think about premiums that we pay. We think about that policy, if you will, that we have that allows us to go to the doctor when we get sick.
Yes.
Let's take a step back.
All right.
As healthcare, as HR leaders, myself included, I think we could do a much better job of emphasizing wellness and preventive. Right?
Okay. So it starts at wellness and education.
It starts there, educating employees about the importance of having a primary care physician.
Yes.
Who is the gatekeeper for their health care. Advising employees of the need to get an annual physical or an annual evaluation. That's so critically important to be done every year, so that if there are things that are on the horizon, they can get caught early, if not prevented. Wellness programs, proper exercise, proper diet. And it's critically important now, especially since COVID, to make sure that our employees are doing all that they can to be mentally well.
Yes.
Meditating,
yes.
Talking to clinicians if we need that.
Yes.
Therapy if we need that. So all of these things combined help our employees continue to be well. And so I think HR leaders can do a great job of stressing the importance of mental and physical wellness, as well as preventive.
Yes.
Can't overemphasize preventive.
Yes. So most of the time, HR professionals, we have it. We have all of those things. But if we are not distributing that information to employees and doing it in a way that it highlights it, and highlighting that information and getting the information out to the employees, they have a serious source of resources. But if you don't know it and you don't take time to read it,
that's right.
You don't know it. So that's where HR professionals can come in to make sure that information is given to employees.
That's right, and it's health literacy. And I looked at a statistic just yesterday. As a matter of fact, a statistic from SHRM.
Mm-hmm.
At least half of the adults who have employee-sponsored healthcare plans, they don't fully understand their healthcare plans, don't fully know the difference between a PPO, a high deductible health plan, or an HMO. So conversely, you'll have employees who will pick a high deductible health plan because it's a low premium.
Right.
However, a high deductible health plan also comes with higher out-of-pocket costs.
Yes.
So once they're enrolled in that plan, they put off getting certain things done that they may need done because of the out-of-pocket expenses that are associated with it. And they delay treatment, they delay care, and then until something major happens. So that's just not the best choice for some people if they don't understand how to utilize the plan. And it's also probably not the best choice for someone who has chronic health conditions.
Absolutely.
So all of that kind of information has to constantly be disseminated to employees, share with the employees so they fully understand how best to utilize the health care that they have.
So HR, you can be that educator, right?
Absolutely.
Always bringing a new point or a new highlight about that insurance to your employees.
Yes.
Not always being seen as the bad guy, but be seen as the good guy sometimes.
Absolutely.
And bringing this information. Have talks, have webinars, have lunch and learns, all those things that we've done in the past, right?
That's exactly
right. To keep employees informed, and regardless to your size, mega companies, smaller companies, you can do those same things to educate your employees. So the C-suite, how can the C-suite play a part in tackling disparities?
Another excellent question. You came loaded today. So in the C-suite, leaders care about the bottom line, but they also care about attracting and retaining quality employees, and having outstanding benefits are one way to attract and retain talent. So I'll go back again to HR leaders helping employees to become health literate.
Okay.
When they become health literate, they become more efficient and effective utilizers of their health care benefits. For example, they don't go to the emergency room for a non-emergent incident.
Yes.
They go to a primary care physician, or they go to a wellness clinic, right? So those types of decisions impact the bottom line. So from the C-suite perspective, you can get them engaged from that aspect, because when employees are health literate, when they utilize the plan effectively, they lower the cost of healthcare. If not lowering the cost of healthcare, stave off rising increases that could occur if they mismanage their utilization.
Yes.
And a big aspect of it as well, there's a community piece to it as well.
Okay.
So C-suite leaders, it's incumbent upon C-suite leaders to be attuned to what's going on in the community from a health disparities perspective as well.
Yes.
And for organizations and leaders to play a role in helping the overall community to become more health literate. Because guess what? we're recruiting from that larger community.
Absolutely.
So you want to make sure that folks that you're recruiting from, particularly those individuals coming from underserved areas,
yes,
that they have some baseline knowledge, right,
yes,
of healthcare, how to manage their health to the best of their ability. Because once they come into your organization, once they come onto your healthcare plans, you know, there are costs associated with that, in addition
yes,
to making sure that they have good outcomes, that they're healthy. Healthier employees tend to have fewer absences,
yeah,
right? Healthier employees tend to be more productive.
yes.
So now you see now you see a more global concern that
yes,
confronts the C-suite leaders.
Yes, and so that's why we call this innovation global
That's exactly
solution.
right.
So all of us need counsel. So here's the person you would need to call. The company, you need a consultant that can help you decipher and navigate through this topic of healthcare disparities and how we can do that at a alarming rate. So can HR be an influence on the governmental and legislative side of this? You know, so oftentimes we shaped by how we do things by policy. So how can HR professionals be in tune to governmental and legislative levels and the impact of disparities?
Oh, absolutely. So from the local level to the state level to the federal level, there's always legislation coming through those bodies that impact healthcare. So HR leaders partnering with SHRM, for example, can write letters to their state legislature,
yes,
to their local legislative bodies, to their federal legislative bodies, advocating for legislation that will improve the health and well-being of a community, that will address health disparities, that will lower the cost of health care. And also, they can lobby against, if you will, or oppose legislation that would be detrimental to the health of their employees, of the local community. So that's one way that HR professionals can get involved.
Absolutely.
I know the American Cancer Society, American Heart Association, they have governmental affairs people who they spend time at the state houses, they spend time in Congress,
yes,
monitoring those bills that are coming through, giving HR leaders, giving employees an opportunity to weigh in by writing or phoning their legislative leaders. So that's one way that HR leaders can get involved in the legislative process.
Right, and so that partnership between HR and between SHRM can help you do that. As Mr. Robinson said, they can help you do that, to get involved in the governmental parts and making policy toward this. So, in your professional opinion and guidance, what can the HR community do to make the greatest impact for disparities?
Sure. Partner with local churches, partner with organizations like SHRM, partner with community organizations to make sure that we're calling attention to these disparities.
Yes.
Food deserts, if you will.
Yes.
Food deserts are a major barrier to young kids, families being healthy. It's hard to be healthy when you don't consume the right nutritional foods.
Yes.
So partnering with community organizations, partnering with churches to address some of the systemic issues that play into these disparities. I think that's one of the things that HR and companies can do as a whole, because again, if we're educating our employees, we can then deploy the each one teach one model, where our employees go out and partner with these organizations and help the larger community to become more health literate. And again, it's all about advocating. In America, I firmly believe that no individual should become critically ill or die sooner than than necessary because they don't have access to quality, affordable health care.
Mm-hmm.
To me, that's not acceptable. So, but I think it's not just private employers. It's not just the government. It's employees of these companies, as individual citizens. Yes. We all play a role in helping to improve the health and well-being of our communities.
Yes, we are all part. We are all in it together, and we all make it happen. Thank you so much for coming in, Quintin Robinson and Innovative Global Solutions. This has been wonderful. How would people get in touch with you or get in touch with your company?
Sure. Phone number is 901-305-1698. Email address is quintin.robinson.igs@gmail.com.
All right. That's how you can do it. Get involved. That's how you can help in the healthcare disparities. Wow, this has been a show to encourage HR professionals and organizations on how to make a difference in the crisis of healthcare inequities. HR professionals have influence and can make it happen, one voice at a time. Be sure to watch Let's Talk HR with Dr. Deneen every second and fourth Friday on the YouTube channel of the same name. Please note, you can watch Let's Talk HR with Dr. Deneen and prior episodes at any time. Go to the YouTube channel and type in the talk show name. But if you want to be notified when new episodes post, be sure to subscribe at no fee to the channel and click on the notification bell. This is HR TV. I'm Dr. Deneen, and I want to talk HR with you. HR forever. See you next time.